operations temporarily and might have extra supplies available. Logistically, this effort came together by a great collaboration between the materials managers at our area hospitals to stand up a database giving us real-time insights into the most urgent PPE needs across the hospitals. And our goal is, with the help of materials expert Joe Nusser, who was graciously made available by OneWA, to take in supplies and distribute them based on a real-time need to the hospital partners. I would like this opportunity to thank not only the mayor for all of her gracious support in standing up this initiative, but also especially John Spain with the Baton Rouge Area Foundation, whose leadership and whose insight was the catalyst for a lot of this activity. Without further ado, I'd like for him to come up and talk. Thank you.
Good afternoon, everyone. We are here because we have a crisis. We have a crisis in the shortage of critical equipment for the heroes who wake up every day to help our neighbors, help our citizens as we go through this virus. Those are our healthcare workers. They need protective clothing, they need masks, and we are fast running out of inventories. We are here with the mayor's leadership and leadership of each of our hospitals and health district to make a plea to everyone listening or watching this announcement today. If you have inventory, if you have the capability of manufacturing PPE or masks, please call the number that will put you in touch with a central collection site here. And those materials will be distributed to the local hospitals based on urgent need. This is not a normal press conference. These are not normal times. This is where the leadership of the health district, the hospitals, the mayor, her staff, and this community are asking you to please pay attention to this shortage. Those people that get up every day and literally put their lives at risk working in our hospitals as healthcare workers need your help. If you can help, call the number 225-763-4240. If you've got masks, PPE, have a company that is capable of manufacturing those, please call. We'll work out the details. We'll help make it easy for you. But we are in the middle of a crisis, and without this response, our healthcare workers will be put in even more jeopardy without the proper protection they need. Thank all of you. We appreciate the role the media plays in this issue so that you can get the word out to our citizens. We thank you for your leadership and help. And Mayor, thank you for your leadership.
Thank you, Mayor. Thank you, John Spain. Thank you, Steve Kulemans, for y'all's work to put this together. Our team has been working behind the scenes of the Baton Rouge Area Chamber to try to make sure we're contacting businesses to identify those with the manufacturing capabilities within the fields that we've been discussing, including many who are not directly in the field of manufacturing this kind of product in a normal environment. And we've seen this as an opportunity for companies to pivot what they make into what is needed. And so we've seen some already stepping up to work behind the scenes with our hospital partners to identify if they have the ability to certify that certain products can be made available in a short-term period of time and stand up that work as fast as possible. So we continue to do that work. As John said a moment ago, we put that call out to you today as the business community. We're going to be doing that out directly ourselves yet again, as we have already started over the last 10 days or so, pushing that request out. So if you're a manufacturer, if you're a company with a number of employees who are idle because of changes in your business, but you think you could be in this business, even if you are not, consider looking into it. Be in touch with us, be in touch with Steve and the folks at the Health District. We can help offer consulting services or advice to you about what that could look like. Also to find out what the specs would be for making some of these kinds of products. Some of the things that we've been looking for in donations, as you heard earlier, we want to make sure that call goes out to not just the industrial community who has really responded rapidly for things like masks and sanitizer wipes and gloves, but many other kinds of things are possible, and many other kinds of businesses may have supplies. Some companies have already stepped up that I want to just highlight and thank. There have been companies like Exxon, Methanex in Ascension Parish, and Rubicon who have donated. in Ascension Parish, and a restaurant, actually, although we know a lot of restaurants are in trouble right now. One has reached out called Crispy Crunchy Chicken. That's in a lot of the gas stations around our community, and has provided sanitizer wipes. And so you may not think of that as something that you would normally do, but do reach out, as you've heard today, and give what you can. And if you can change what you make so we have supplies in our community. I want to just thank Daniel Birch, by the way. I think is great what he's doing to make sure that he's available throughout Louisiana. It doesn't get heralded for what he does. And now he has to sign his own name. Thank you.
That was certainly a well-deserved shout-out for Daniel, unsolicited. We greatly appreciate you. I will also, once again, like to thank the Baton Rouge Metropolitan Airport, all of our health providers who are here. The Louisiana Chemical Association is represented today by Greg Bowser. Thank you. And all of our hospitals have representatives here. Thank you to all of our hospital partners who are here today. Now we'll take any questions that you might have. Yes?
Yesterday, the governor said his most short-term concern is ventilator capacity. Do you share those concerns, especially as the number of cases in Baton Rouge starts to grow a little bit faster?
I think I heard you say ventilator capacity. Capacity at all levels, and that includes ventilator capacity, absolutely. As you know, we talk about a whole community approach, and so we have to talk about a whole healthcare approach in the midst of that is couched in, and that means everything that is necessary to keep our citizens alive and help them in the recovery of COVID-19, and certainly ventilators are an integral part of that, so absolutely. Terry? Adam?
You said you guys have been working to try to identify different businesses and manufacturers who can kind of chip in here. Do you guys have any idea of percentage of businesses in our region or a number that could possibly pitch in here?
The question was whether we have a percentage of businesses that could possibly shift to be making products. No, there's not a percentage. We've been specifically targeting companies that seem like they make a product that's relatively close to this, or have supplies of something that they make that is relatively close to some of the kinds of PPE requests that are out there. So when we've been looking for companies, we've been doing more targeted searches to see which ones seem like they could already switch. And what we've been doing more, and you hear today, is rather than targeted specific outreach, is putting an all-call out there. If you're thinking about this, please reach out to us. Even if you don't know yet. Obviously, a lot of folks at home have been trying to figure out how to make masks for themselves, and you've seen a lot of creativity happening around the country. One of the things that we've seen examples of is, we're not yet ready to say we're there yet, but we're looking at the idea of 3D printing of some of the supplies from local capacity for 3D printing and manufacturing some of the capabilities we are blessed to have in our community because we have LSU and Southern here. And some incredible, brilliant engineering talent and technical capabilities. And so those are things that are in the works that we're looking at to see if that's a possibility. But right now the focus is on the call for donations and how to manage the logistics of donations and helping everybody who thinks they have even 1 or 5 or 10 or 100, you donate what you can, and then we'll see what we can convert to be manufacturing as well.
I know you said this distribution center is going to be primarily focused on taking donations from the business and industrial community. Do you have any interest in maybe doing something more community driven as well, leading that in the future, near future?
Absolutely. Not only are we seeking donations from our business community, but we are seeking donations from the community at large. And I will tell you, we've had people responding in that space as well. Today's focus is the business community, but we've had people donating from the community, and we've been taking those donations at MOSEP, which is right down the road.
David, this is where it's all going to happen. Can you kind of walk us through the process? Is the business going to come, drop off items, you're going to put them in the truck, distribute them to the hospitals, or how's it going to work?
We're going to let one of our, would you like to? Making sure we don't bump into anything.
I might be able to help here. We've had the great opportunity not only to work closely with the materials managers at each of the area hospitals to get input and insight into what the priority items are of highest need, but also work with the antimicrobial stewardship experts at multiple hospitals to really define a safe process to make all of this work as best as possible logistically. Some of the hallmark items that includes is we'll make sure as we take in supplies that there is first of all of the workers that will present here that will be part of the effort will be, that their temperature will be tested. We'll be checked every morning before they report to work. Anyone with a temperature over 100 degrees will not be able to work. We will also set up a 6 feet buffer zone for inbound supplies where all of the drop-offs can be delivered and then safely handled by our staff through mechanism drop-off and pickup. The same will apply for our outbound supplies as we deliver in the afternoon. So the general flow will be 9 to 11 inbound, 11 to 1 o'clock process of supplies, 1 to 3 p.m. outbound supply deliveries. There will be a buffer for both inbound and outbound of 6 feet that will be visually marked. And all of our workers will wear gloves, PPE, as they handle cardboard boxes based on the guidelines of the different antimicrobial stewardship and infection prevention departments at the hospital.
Since a lot of us are kind of live on Facebook right now, can you just say the address of where we're at and where this location is?
Let me just make sure I get it right. 9455? Our address is 9455 Plank Road in Baton Rouge.
That's just for commercial, that's not for people, it's not general distribution.
How will the logistics work to determine where the supplies go in terms of going throughout the medical? Will hospitals be contacting you? How does it work?
So we have an ongoing task force with all of the materials managers from the different hospitals to determine the items of highest need. And they are posted on our website on brhealthdistrict.com as well. And those will evolve over time as the priorities change. We have ongoing task force calls and huddles on a daily or bi-daily basis to update supply and demand in close to real time. We have a logistics expert from the chemicals industry, Jonas Sayre, who is assisting us and implementing best logistics practices. He is setting up a centralized database with centralized item descriptions that can be shared between all of the hospitals to coordinate deliveries as best as possible. He's got a background in SAP, inventory management, as well as in Lean Six Sigma, supply chain flow best practices, and those will be implemented as we start setting up and staging here later today.
It was said that there are some groups that have already stepped up, some companies that have already stepped up. Are there supplies here yet, or is that coming today?
The supplies will be coming over the initial set. We have a couple dozen companies identified and standing by to deliver supplies with the great help of the area chamber. We will start setting up our warehouse facilities later today, and there's a number of quality precautions. For example, none of the supplies can touch the ground, so the racks and the pallets, a lot of the critical infrastructure will be set up here over the next 24 hours so that we can start taking in some of those scheduled and identified industrial supplies as early as tomorrow, anticipated to start distributing as early as Monday. And then the general supplies from the public, we will plan on taking in starting next Monday, the 30th as well.
Well, once again, thank you all for being here today, and thank you for helping us get information out to our community as we battle and work through the COVID-19 crisis. Thank you all so much.